bring you today in Global Health a look at global health standards, expectations, views, from our studios here at 26 Cafe Street off Aolo Road, Ikoyi, Lagos. And we get into the conversation where we go all the way to Canada. My co-presenter and also a panelist and expert in health and, should we say, the legal aspect of health as well. He's a lawyer, by the way, so don't just think he talks health. If you do things the wrong way, he will deal with you, legally speaking. And that is Professor Uche Ngwaba. Good morning to you.
Good morning, Coyote. Always a pleasure being here.
Great to have you as well. Good to have you join us. And what's it like right there? I know it's still early morning, 5 a.m. if I'm right.
Yes, it's 5 a.m. The weather is changing. It's getting cold, and it's 9 degrees at the moment.
Wow. Okay. All right. So we want to continue with our conversation from last week, where we're looking at AI. We're looking at the impact of AI and how it sits with us. And where one of the sad things we discussed last week was the fact that a country where we are still, to a large extent, struggling, contending with providing steady power supply in our hospitals, where we're still struggling with getting all the, what do you call this, things that the doctors use? There's a word for it, it just escaped me now. I'm getting it right in our hospitals.
Yeah.
We're now thinking of AI.
Yeah.
I don't know.
That's a lot to take in.
It is. It's a lot to take in. Believe
That's a
me.
lot to take in. Yeah, but then the AI value chain is quite extensive, and that's one of the reasons why I have with us today, and I'm sure you're going to introduce him, Mr. Ern, to talk about an aspect at least that we are currently dealing with, the digital aspects, which is part of the stepping stone towards AI. And so there's a lot of connection between what we're going to be talking about today with what we talked about last week. But I mean, from what you have said, there's indeed a really reason to be concerned that we have a long way to go. And unless we are very sort of intentional and very strategic about where we are going, we're going to be in a lot of trouble. And so from the conversation we'll have today, we'll get to see where the trouble starts. And then we build on to other areas where we would need to be very, very strategic going forward.
All right. And having said that, from right here in Lagos, we connected with you, Professor Ngwaba, Uchechukwu Ngwaba in Canada. And now let's go all the way to Kenya, where we will be meeting.
Well, before you introduce him, I'd like to mention that Mr. Allen is actually here in Toronto at the moment. He's visiting Toronto from Kenya.
Okay. Okay. All right. Great. Well, I mean, so it's not a full tripartite then. It's just a two-way thing. Well, anyway, we'll deal with that. I was happy that we have another African from Africa joining me. So I'm alone in this African identity.
You're alone in this identity.
So Alan Maleche is the Executive Director of Kenya Legal and Ethical Issues Network on HIV and AIDS. That's Kellen. He's a legal expert with a robust background, holding an LLM in national and global health law from Georgetown University, complemented by a Bachelor of Laws (LLB) degree. With a distinguished career spanning over 15 years, Alan is a seasoned advocate for human rights. He envisions a future where health-related rights are not only promoted, but also protected, respected, and fulfilled. Alan's academic achievements and extensive experience underscores his commitment to advancing the cause of human rights in the realm of healthcare. We say to you, welcome to Lagos Talks 91.3 FM. Welcome to the show. Good morning, Alan.
Good morning, and thank you so much for the warm welcome. Sorry to disappoint you. We could always do another show when I'm in Nairobi, and Uche is in Toronto, so I'm happy to do another show next time. from
Great, great.
Absolutely.
Nairobi,
We're
and then
thinking
we can
about that.
fulfill your desire of another African being in
Okay.
the continent with you. But happy to be here with you this morning,
Great.
and looking forward to the conversation.
Yeah, great, great. And now, let me, before I even go back to Prof, let me come to you. In the area of AI, infusing AI into healthcare in Kenya, look at Kenya as it stands today. Is it ripe? Is it ready for such an infusion that is AI in healthcare? Or are there still many things you need to do to meet up with the global health standards?
So thank you for that point. I don't I don't believe any country would ever be ripe for taking up AI or digital solutions in their health interventions because it's already happening. It's a question of how well is the country adapting. And so in the case of Kenya, AI and digital health are issues that have continued to evolve. And what we have found ourselves as health practitioners, human rights lawyers, finding out how well is the system able to cope with this in terms of one, are the personnel having the capacity to understand how to use AI and the digital technologies that exist? B, as for us lawyers, what are the legal framework and policy frameworks in place that guide the rollout of this particular AI? Three, what infrastructure does the country need to be able to ensure that they're able to roll out the AI? And most importantly, as a lawyer, should any disputes or any issues arise, is the judicial and redress mechanism in a place to be able to solve the issues that may be brought by the use of AI. So for Kenya and for every African country, it's not a question of whether they are ready. It's a question of they have to be ready because this is already taking place. This is already part of ways of the health system, either in the private or public sector. And the key concern here is what should countries do to ensure that they have an enabling policy, legal, social environment that then promotes the use of artificial intelligence and digital technologies in a way that makes us realize the right to health as we all aspire to do it in the Kenyan, in the African continent, in line of our commitments with the international conventions, our regional conventions in Africa, our famous Abuja Declaration, which was done in your country. How then do we make that right to health a reality, and how does AI and digital health get used in a way that is good, that doesn't do harm, and actually really gets people to enjoy the highest attainable standard of health?
All right. And we will come back to you shortly. But before we do that, let me go back to Prof. Gwaba. We started this conversation last week because
Mm,
Alan made a statement now about digital health, which I'd like us
yeah.
to touch on. But before we go there, let's
Mm,
bring Alan and some of our listeners up to speed. The conversation we had last week, the robust but also very confusing conversation we had, which cast a lot of doubt and raised a lot of
mm,
questions about preparedness and what we need to
mm.
do. Let's do a quick recap of that. Then we'll launch into the next phase of this conversation.
Okay, thank you, Kayode. Yeah, for our listeners, we recall that last week we got into the discussion about how to balance innovation and regulation in the context of artificial intelligence, the ethical imperatives that the African healthcare system we're facing. And as part of that conversation, we grappled with this idea of artificial intelligence and what its uptake meant in the healthcare field across the African continent. One of the issues we really zeroed in on was on this idea of data. If our listeners will recall, for those of them who were able to tune in, we spent a bit of time, raising concerns about whether Africa was well positioned to leverage, the very preeminent place that, data was now beginning to sort of take in the AI space. A very sticking point in that conversation was really this concern that data colonialism was now a phenomenon that was occurring on the continent. The fact that the African continent was not a site where data was being extracted and offshored to other jurisdictions. The fact that the infrastructure on the continent, and something that Alan has also mentioned in his opening comments, the infrastructure is far behind and hasn't really positioned us, to become, significant players. Of course, I related some of my experiences from the conference I attended in Cairo, where I saw some of the quite laudable steps that were being taken on the continent to develop policies and frameworks. But then I pointed to the fact that the African continent wasn't recognized as a site where AI policy ideation could take place, of course, because of the very peripheral position of the continent in so many aspects of global affairs. And so ultimately, we promised to revisit this conversation in greater detail. And so today's conversation sort of segues into that, because it's a continuation of this conversation, speaking on the digital space, but then we are focusing on an aspect of the digital economy that has implications for in the long run for the AI value chain. Today's conversation, which I have, and I'll tell you a story, Kayode, how this came about when we swing back to the conversation. But today's conversation really on human rights and phones, what every young person should know. It's actually very much connected to this conversation we've been having on the thematic focus of artificial intelligence and data and those technologies.
All right, and so let's take it a notch higher here. Let's look at, like I said, when Alan was speaking, he made reference to the digital health. And we know that there's something called the Digital Health and Rights Project. How does that sit, and what role does that play in all this AI and in healthcare?
So I will invite Alan to respond to this, but before he does so, I'd like to tell you how this whole thing came about. So, and that would make you understand and make our listeners understand where this is all going to. Now, yesterday, I attended a phenomenal talk that was delivered by Alan at the University of Toronto. People are wondering why Alan is in Toronto and not in Kenya. Well, the reason why the reason why Alan is in Toronto and not in Kenya is because he was invited as a guest speaker by the University of Toronto Faculty of Law to deliver a very phenomenal talk. And I think, Alan, you'll correct me, but I think is when health rights are litigated in court or something like that. Can you?
Yes, the topic was from clinics to courtrooms, the link between law, public health, and human rights.
Exactly. So it was such a phenomenal talk that Alan delivered, bearing on his program of research around, and also his activism on the ground. Alan is a phenomenal health rights lawyer in Kenya, and he has been doing a lot of activism for decades on moving the needle on the right to health in Kenya. And so I attended the talk and I listened to Alan. He was so confused. He was so compelling. An aspect of his talk that really resonated with me was when he was talking about sexual and reproductive health rights and digital technologies. And it was quite startling to me what he was saying about where young people these days are getting their information about health, about sexual health and reproductive rights, and how there was a policy gap based on the work he was doing in Kenya. And based on the research they had conducted. In fact, there was a particular handbook that came out of that, which he gave me. And so I said, you know what? This is the kind of conversation we want to have in our talk on today in global health, because this is phenomenal. And so we need to get Alan on the show to come and talk with us and share with us some of this things. So the Digital Health Rights Project is actually a project that Alan has been very much involved with. And so this context is to really show is to really tell you that, look, Alan has so much he has to say about this project and this research that even me, myself, I'm here to learn more about what he's been up to in the context of digital health rights, because he has been very much on the forefront of pushing the needle on that. So, Alan, I think it's over to
Over
you.
to you then, Alan.
Okay, great. So I'll start off by just introducing the project. And again, thanks a lot. So the Digital Health Rights Project Consortium is an entity that brings together international social scientists, human rights lawyers, health advocates, and networks of people living with HIV to conduct research and advocate for rights-based digital governance. And we are having partners in Colombia, the Uniandis University in Ghana and Vietnam. We are working with the networks of people living with HIV through GNP Plus. In Kenya, we have Kelin, which I represent, and in the UK, we have Warwick University, we have Stop AIDS, we have Privacy International, and we have Restless Development. And so this consortium came together to be able to use a transnational participatory action research approach where we center the voices and leadership of diverse young adults to define the future of human rights. And so mid this year, at the World Health, closer, not even closer to the World Health Assembly, slightly before the World Health Assembly, we published a report of our findings from speaking to about 300 young people in those 4 countries.
Okay.
And the title of the report was called Paying the Costs of Connection. And that's the report Prof is talking about, that I was able to share a bit of the findings around what is it that young people face when they are accessing health information on online platforms, and what do they encounter. So the Digital Health Rights Project has come together. We've done this report, we've now published it, and now we're in a phase where we are disseminating it and trying to push for the recommendations to be taken forward at a global, regional, and national level aspect. I think you're muted.
Let me just get that started. Yeah, can you hear me now?
Yes, we
Yes, you can
can.
hear.
Okay, great. So I know you've done a breakdown of what it means and what this stands for. That is the digital
DHRP.
health, yeah, the DHRP.
Yes.
But let's break it down and bring it home right now.
Okay.
Looking at country by country and without any bias or nepotism intended, let's look at Nigeria, the largest black nation. You know, so how does that sit with us? How does that apply to us in Nigeria? What are the benefits? What are the uptakes for us in Nigeria?
So that's really a good question, and I think it's not being nationalist, but it's actually asking ourselves, and partly why we did this research. We would have done it in all the countries in Africa, but of course we had limited funds to be able to do this. But I think, why does this report or this research finding matter to Nigeria? It's because the issues are deeply relatable. The study talked about how digital tools are increasingly shaping how young people seek health information, how they navigate stigma, because we are also speaking to people living with HIV, we are speaking to sex workers. How do they try to access services? But also, how do these tools not cause them any harm or expose them to harm? So even though Nigeria wasn't one of the study countries, the findings, in my view, echo what many young Nigerians already know, that being online does not always mean it's safe or empowered. And so what this research and the findings do is that they give us a blueprint for how to make digital space work for young people and not against them, especially when they are in the process of using online platforms, online spaces, to be able to get information that will inform their health decisions, and particularly for the case of this study, those that deal with sexual and reproductive health and rights. And later on, I'll be able to speak to some of the risks that we picked up that I feel would highly resonate in the context of Nigeria. So my answer to you is that for anyone who's reading this report, read it from a point of view. Yes, Nigeria was not a study country, but are there things in this report that I could relate to that happen not only in Nigeria, in any other country in this world? Because we have a Latin America perspective, we have an Asian perspective, and we have an African perspective in the people we interviewed. And that was just a sample of a size of people, but the reasons would likely resonate. And so I would encourage our listeners to look at it from that point of view and be able to then appreciate how that research then becomes
Mm.
extremely relevant.
All right. Two
Well,
things I'll say your report does um, this morning is that one, your report further breaks down the what AI really means. Your report takes it away from that imaginary position to letting us understand that something as basic as digital exposure could be AI related. So when you look at the digital health, which is an aspect of AI in healthcare, the influence of it, are there dangers? And what are these major dangers or risks of unregulated access to digital health? Because that seems to be the next frontier. If you have, for example, if you have a lot of what do you call this? Healthcare, all this HMOs, health management
organizations.
organizations, yes, this health insurance. Now, a
Mm-hmm.
lot of them have their apps, and on their apps, you have access to consult a doctor without
Mm,
going to the hospital.
mm.
So it's good to look at, and now you're talking about your research, it's good to look at what the dangers are being exposed to digital health, because you have a right to that, but what are the risks or the dangers?
Yes, Alan, can you jump on this?
Sure.
But before
No,
you do, I'll just flag, I think in our conversation last week, I think we touched on issues of privacy. We talked about issues of data management and all of that. But then
Yes.
obviously, this is foreshadowing what Alan is going to say. So,
Mm.
Alan, I'll let you jump on this.
so great. I'll do my best to respond to that and also just relate it based on the experiences and the findings we had from the research study that we did. I think, I mean, you said you're the most populous and largest country, let me not even dare say in the world, but we know how far and wide you are. But so we know that Nigerian youth are online just like the Kenyan ones are, and there may be risks they might face when searching for health information, and particularly in our context, sexual health information or services. And some of the risks that we picked up in this report, and I think that relate to your question, I think the first risk for me is misinformation, that we experienced situations where young people got a lot of misinformation as opposed to the correct information. And even if you take it away from young people, I think we could both relate to the COVID pandemic, where the right information traveled slowly, but misinformation traveled faster than the right information. And so that's a huge challenge that we want to address, because if someone out there has specifically designed an app or is using an algorithm to take forward content that is misleading or moralizing people because of their HIV status or their choices in life around their sexual partners, I think that's a concern we have to be aware of and say, how are we handling that? Secondly, and even as you spoke about the insurance apps, the biggest issue is data privacy, because many of us don't know, once you've logged into the app, you've given information, who's actually storing that data? How protected is it? And if that data leaks, who is then held responsible? And it's worse if that data leaks and you're a stigmatized person. Say you're a person living with HIV, you're a young person who may be uh, queer, you're a young person who may identify as LGBTIQ, and that information leaks. How then will you be able to ensure that your data is safe? So data privacy is extremely important, and linked to it also, there are the concerns around surveillance, because the findings of the research showed that young people feared being tracked, sometimes by their family or even service providers, or even in certain governments where they were seen to be criminalized. And then there's a whole concern around shame and stigma, especially, as I said, for those who are subjected to this. So in terms of risks, I think for me, the biggest risk was mostly, do I trust this person to give my data? What happens if my data is breached, and what recourse do I have? But even for us as general people who engage with various apps, we normally just sign consent. We say we accept. We don't, no one, even us lawyers, don't read the whole terms and conditions. When Apple sends you an update and says, do you agree? And you're just like, let's move on. And of course, it's impractical to be able to read everything, but I feel people should then be concerned around who's getting the data, how are they processing it. And then one of the biggest issues, especially with insurance and other health sectors, and unfortunately for the insurance is a concern, who else could they be selling this data to be able to make decisions? I want to know if I'm engaging with Dr. X, is not probably trying to figure out how many people in Lagos have diabetes and how can I share that information with a pharmaceutical company so that they then direct work and business in that particular direction. So data privacy, very key, misinformation key. In some areas, surveillance by government and other people would be key. But in the context of people living with HIV and discriminated groups, the issue of stigma, the issue of discrimination is a real fear. And then there's also, lastly, the risk, which I should mention, and it came out yesterday a lot. There's a risk of violence. It could not be physical violence, it could be verbal violence, it could be leaking
Emotional.
information of people, it could be emotional. So there is a whole thing that people lump and call technology facilitated abuse, but it's just generally violence in another form. Or people could decide, and I think we've seen this a lot on social media platforms, they could decide to go for a person and fill their inbox, call them names and things like that. And that's something that we have to be alive to, that there's a risk that people would face violence, and then how do we safeguard them in the process? So quite a number of risks, but just pulling out the ones that stood out and probably could also resonate in the context of Nigeria. Back to you.
All right, and Prof, I
Yeah.
know that today Alan has focused a lot on reproductive health and the risk in it, and how,
Mhm,
of course, some of the risk he highlighted actually they relate to other health cases as well.
mhm,
But when you look at all what he has said, and
mhm.
we talk of AI coming into a play in our healthcare. I like what Alan started with saying it's not a case of are we ready? Nobody is ever ready, but you need to just work and put yourself in there to be able to take advantage and make the best use of AI. Now, with that in sight, when we say we're migrating to AI or infusing AI into healthcare, does it mean that governments have one major responsibility of educating the average Nigerian on digital rights? And beyond that, if that is, what are some of the other responsibilities, things that we must approach or address from the on-go to ensure that migration or infusion of AI does not become a total danger to privacy and quality healthcare?
Okay, thank you, Coyote. You've asked two questions. Does the government have the responsibility to educate young people around AI, and what steps to make sure it doesn't become a danger? Um, Coyote, let me be a bit cynical here. I think it is actually young people that need to educate the government because in this AI dimension, the younger generation actually are more attuned and are
Mm,
more, accepting of the realities of the artificial intelligence and what it means for the way we carry on in our society than, the old souls that are in government. Because many of the old souls that are in government are still learning how to operate a computer. Do you understand what I mean? So, like, how do you want to communicate this idea of artificial intelligence to, I don't know, I don't know what happens in your local government in Lagos, but I don't want to, I want to assume that the good souls who are in charge of the system in these areas, or think about any remote part of Nigeria, you expect them to be coming up with the policies that would respond to, artificial intelligence or to teach young people about artificial intelligence. I guess to a point where we need to understand that um, there is a partnership that needs to occur. And maybe our leadership in the country should begin to infuse more young bloods, people of the younger generation who have dedicated themselves to really understanding artificial intelligence and what it means, to help to sort of like revive the thinking or the pool. Something that came out of the talk yesterday when Alan was speaking was he mentioned something about the digital divide, and maybe he's going to come around to it. He mentioned something about a digital divide in the way technologies are being uptaken in the context of, sexual and reproductive health rights. Even in the context of access, not everybody's access is the same. So I would like to sort of twist that context or that concept he has used and use it to express, for my purpose, to express what I'm trying to get across, which is to say there's a digital divide between the older generation and the younger generation that needs to be bridged somehow. So to your first question, Kayode, my answer is it's actually more serious than that. It goes beyond just the government educating the younger ones, because there's an assumption in that question that the government and people in government already know what
it is.
But my thesis to you, my argument to you, is that actually there is a lot of ignorance at the top around this, because that's a different generation, and it's not coming out of any negligence on their part or any. This is not me blaming them for not doing anything, for not doing something about that. It's just to say it's a different generation. The people who are driving this movement are young, young forward-thinking entrepreneurs, and investors. But then, yeah.
Well, I mean, before you go ahead with answering the second question, so should it be like the situation we have with tobacco? When you talk tobacco today, what you hear is on every pack of cigarettes that you buy, it is boldly written there, tobacco smokers are likely to die young. That's the way it was. I know the wordings have changed over the years, but I mean, you see that. So should it be a case where governments, knowing that we now have to infuse AI in all this, the CSOs and experts like you will begin to engage governments and ensure that every stakeholder, particularly those who are bringing whether the service or the technology, have this clause there that educates people on their rights, their digital rights, what the limits are, what to look out for. Because governments might not do this. We've seen many things governments in Nigeria and other parts of Africa have led us down on. And the people who are to consume might be too much in a hurry. Just like we don't read the terms and conditions, we just flow with it.
You're right. I think you're onto something here. And I think that I'm not sure that a warning label will necessarily be effective, because the way it is, we are embodying it. For example, AI is being embraced as making life more simple for us or more efficient for us. In the past, you want to get information about something, you Google it or you go search in the directory and all of that. Now you just pick up your phone and you just type in a few things. Now with artificial intelligence, you just say a few words and your phone is doing the command for you. Like, yes. Okay, look for restaurants that serve jollof rice around me. And your phone that is artificial intelligence. Yeah. That's an aspect of it. So you're not gonna, how are you going to tell me that you now have a warning label? Beware that this is dangerous. Using this product, like nobody's going to take you seriously because, like, oh, it's dangerous. Oh, let me into the danger because it's making my life very simple. Do you understand? So, like,
But at
that
least
is
telling
not.
us about our rights, what we should know, maybe.
So, but yeah, so that is that part. So I use this to just illustrate the part that the fact that a warning label doesn't really map well to what we should be doing. What we should be doing is we should be thinking about the way we have organized ourselves in the past. We should think about our curriculum. What is being taught in the primary schools these days about artificial intelligence? When are kids being told about artificial intelligence before they begin to encounter and use it? What is being taught in our high schools, in our secondary schools? What is being taught in our tertiary institutions? Different professional groups like the nursing profession, the medical profession, the legal profession, the accounting profession, just you name it. Are they integrating an aspect into their curriculum that reflects artificial intelligence? What does artificial intelligence mean for this industry? So there needs to be a wholesale revision of our curriculum because that is already taking place in other countries. I was reading somewhere that China is now introducing AI training to kindergarten children, like kids, very young kids, So Nigeria is being left behind. Again, the digital divide idea comes to mind. I think it's something I'm fascinated with. And this is just essentially like we had the digital divide when we came to mobile technology. We had the digital divide when we came to landline. Now we're going to have a digital divide when we come to artificial intelligence unless we begin to sort of act proactively. Now, let me quickly address the second part of your question before I hand it back to you and Alan. The dangers. The dangers are rife.
Before you get into the dangers and the risk, you made mention of the fact that China, or say Japan, is already introducing its students, the pupils, primary school students, to artificial intelligence. And it got me thinking that in a lot of our primary schools, we're still teaching the head is used to carry load.
Okay, you're cracking me up this morning.
So what you're saying, if you say that, is that it's a hopeless condition for us because we are not even there yet.
No, we're not even close. We're not even close. And that's what is the hopelessness is not that we're not close. The hopelessness is that we don't even know that we're not close. So
exactly.
So those are two different layers of concern. And you're right. I think, and this is where a program like this is very important because a program like this allows us to platform these ideas and put it out there. And I'm sure listeners are taking it on. I'm sure a few policymakers are listening and are thinking, okay, maybe there's some truth to what these people are saying. There needs to be a policy revamp around technology. And I know that Nigeria has been doing a fair bit around the digital economy. I've been seeing a lot of that going on. We need to talk about our educational sector as well. We shouldn't stop at the economy. We should look at the educational sector. We should look at how are young people accessing information about digital issues, digital services, and all of that. Where are they getting this information? Are they stumbling onto it because their peers told them about it? Are they learning about it from the internet? Or are they being taught? And this is the gist of what Alan's research is really getting at, to say, like, there are a lot of risk factors when you leave very young, precocious minds to discover the world on their own, on their mobile devices, without some sort of guidance, without some sort of education that sort of set parameters to let them know that there is a healthy way to engage with the internet. There's an unhealthy way to do so. Our generation, you and I, we encountered technologies when we had already, come to a sense of our identity of who we are. So we already had fully formed ideation of ourselves, our self identity. And so by the time we were engaging with these technologies, we were doing so on our own terms. Artificial intelligence is not likely to corrupt us in terms of how we think of the world and how we view our place in the world. But imagine a child that is born, today. And the only thing the child knows is that the world has artificial intelligence as a part of its ecosystem. Yeah. And that my parents are not smart enough because they belong to an older generation. And so they have to learn from me. Now, you know that children will always be children. You know the silly things you did as a child,
Mm.
but then those silly things you did as a child, they did not carry the risk of stigma or lifelong implications.
Yeah.
Today, if you make a mistake and it's captured by the internet never
Yes.
forgets.
You were not overexposed in our own time. Even your
Exactly.
thoughts were framed within an ideology. But now
Exactly.
the world is in your palm.
Exactly. And Alan has been laughing, and I'm sure he has a lot of
Yeah, I'm
ideas
sure
to
he
say
has a
about
lot
what.
to say.
Please, Alan, please jump in.
I have held myself in and I'm ready to jump in when you guys would allow me, especially on this digital divide, just to, if it's okay to build up on what Professor
Please,
Ucha said. So
please.
I think you raise an important issue and you'll see how this plays in terms of the literacy aspect that we have been asked. So I think I'll start by saying in our report, we identified digital divide to refer to inequities in access to the internet, which is something we've just talked about, the actual digital tools, and then what we are now grappling with, the digital literacy, because there are those who know, there are those who don't know, there are those who are being deliberately being taught, and there are those who are deliberately not being taught. And the way these differences deepen existing health, gender, and social inequality. So when we talk about digital divide, there are aspects to it. There's one, can you even access the internet? Can you actually, that's one. Is there connectivity? Do you have to buy data? What do you have to sell to buy data? And then there's the actual tool. Can you have the app to, do you have a phone? Does the phone have enough bandwidth to move? And then there's the aspect of literacy that we're now grappling with. How much do you know? How much do you need to be taught? And who's responsible for that? So I think from the findings, we saw that most youth, especially in low-income households and rural areas, which is also something that is normal to Nigeria and normal to many parts of the world, or even those in conservative settings, often lacked access to smartphones, reliable data, or internet. For instance, in Colombia, I know it's not in Africa, but it has a lot of resonance with some African ways, and especially Kenya. The participants from rural regions faced challenges due to poor internet infrastructure and digital tools that limited their access, okay? But then the most striking thing for us back home in Kenya was that some youth could not afford data bundles, and that limit their ability to engage with anything. And then even if you want to move it to a level lower, we saw the context of a situation where girls or young women were more disproportionately affected by the limited access. And I think there's a Ghanaian youth who talked about her desire of using her phone for health queries would be questioned or monitored by parents, reducing her ability to seek confidential care. Now, to the issue we've been talking about, the digital literacy and confidence. I think there's responsibilities on the government to be able to start from an early age, a curriculum that young people know, but also for them to step up, even though we know the nature of some of our governments. We've got head of ministries of IT who probably don't even know how to use a computer or do not resonate with that. But then it's up to the governments because they have a responsibility to ensure their citizens know these things. But half the time they don't. And that's where the private sector and sometimes mostly heavily NGOs step in to provide that digital literacy, but it's very limited in terms of who can you reach, how can you reach them, and how can you then be able to do it. And then there's also this issue of bandwidth. Sometimes you'll find when people create apps, and I remember this when I was told when you're doing our website that you don't need to create a heavy website because it'll take long to open, and someone in a place with poor internet connection will take long to download things. And that's the same thing with apps. There are people who design apps because they're based in the north where internet connection may be very good, so you can download quickly, but there are rural places where in Africa there's no internet connection, and even if it's there, it's slow. So if there's an app designed that way, you're already by design excluding a certain group of people. And that's part of the digital divide you're talking about, that when someone is in Silicon Valley developing this app, are they thinking about someone in Kano? Are they thinking about someone somewhere in a remote place in Nairobi? And what bandwidth those people have? Are they just creating it for the audience that they normally see in their lives and their faces? And so this aspect of digital divide is very, very real, and it's something that has to be addressed, especially by the governments, because they are responsible to ensure that their citizens are accessing information on the right to health, and if there are barriers allowing you to do so, that would be interesting. And so Professor Uche knows I love to litigate a lot, and we've been contemplating if our government moves towards putting things online on apps, yet they have not provided good internet connectivity, and yet they say you have to enjoy the right to health. Would I argue that they have violated my right to health by not providing a facilitative framework of internet connectivity? And they're telling me, if you need to get this service, go to this app. If you need to do this, register here. But they have not then provided an environment that allows me to be able to register, because then maybe they're saying to register to Clinic X, go to this website. What if I don't have a laptop? What if I don't have a phone? What measures are they putting to make the right to health accessible to me? So it goes back to our first question. Are we ready? There's no option. We have to be ready, because even governments don't know what's going to come for them. They will see strange asks, strange lawsuits, and people saying, but you're telling me to take this up, but you've not facilitated me. So you have a responsibility to facilitate me. And if you don't, I am holding you to account. And so it is. The digital literacy is something that's extremely important, and I definitely would urge many governments to think this from a curriculum perspective as to when the children step into school. How do we factor this into it? For us, we probably interacted with computers at the tail end of high school or just about getting into university. And that's the first time you ever saw a computer. It was always a book, a pen, but I guess the things have slightly changed. So digital divide is a very important topic, and it's definitely something that is of big concern when you're looking at AI and digital technologies.
Wow, uh, the more I think Prof. Ngwaba is doing me in here. You don't know. I don't know if to say you're doing more harm to me than good, because the more after every episode, I go back and I'm thinking, oh my, are we foul? How are we going to come out of this? Because with what you said right now, and you now brought Alan to the show, who further compounded my worries. Now,
Oh, yes.
one of my listeners from Finland says, when secondary school teachers can't switch on or off a desktop computer, Nigeria is even more moving backwards digitally. He didn't say we are backwards. He said we are moving backwards digitally. He goes on to say, when my 11-year-old has started cybersecurity training in addition to coding. That is in Finland.
Wow.
Cybersecurity.
So this what you have just read has just made Alan's point about digital divide. Because even me, I feel divided.
I mean, what you're saying is true. We're making light of this because it's so ridiculous that all you can do is laugh at it, laugh at yourself, laugh at your backwardness. But the reality, as at today, is that first of all, like Alan said, we don't have a choice but to infuse AI and go digital. Like I said earlier on, if you work in a company now where they have HMOs, the easiest way to access the hospital and even know where the closest hospital is to go on that app, key in your address, and get the closest hospital for you to be attended to. So if, for example, you are there and there is no internet access, heaven is calling, because you can't access the nearest hospital. You might need to go to that hospital you're sure of, and before you get there, your time might have elapsed. But whereas you have access to a hospital just nearby. So whereas it stands now, before we even talk AI, what we're saying here is we must first of all, I'm trying to summarize, then come back to you to wrap up. You must first of
Mm,
all introduce our kids to AI early enough or
yep.
to digital platforms early enough. That is one. Two, we must give quality access to computer use, and computer literacy must be high.
Mm,
And then a lot of professionals, because like my listener from Finland said, a lot of teachers still struggle with using the computer.
mhm.
By the time we're done putting all this in place, knowing how much pushback you get when you're introducing new technology, making it compulsory to do certain things, when will we be ready to really have a functional AI infused healthcare that provides, like you explained last week, better, easier, faster, more accurate health service?
So the interesting thing is that we don't have to finish one before we start the other one. All of these things can be happening in parallel. You already have brilliant minds like Alan doing the work they do, trying to push the needle on integrating AI technologies and digital technologies into the health system to advance what is a freestanding legal right, the right to health. You already have phenomenal scholarship emerging. You have policymakers who are beginning to grapple with these things. What we need is we need an incentive structure for the government to see that there is actually a lot of value that comes from, investing time, energy, and commitments into developing this area. Trust me, if our governments put their mind to it, they're capable of doing it. Just think about the things that animate us, party politics and all of those things. When we put in our technologies, like you said last week, our African technologies into those things. You understand? Alan, the context is we're talking about AI, and Kayode said that even witchcraft is AI, is artificial intelligence. So he said, so we have had artificial intelligence for a very long time. I said, okay, nothing is new under the sun. So once we understand that this is not something that is a matter of choice. It is where the future is going at the moment. Then I think everything begins to make more sense. But, I think Alan has blown our minds today, and I can already see that we will have to get him back to carry on this conversation because, yeah, there's just so much to unpack here. For example, I'd like for us to talk next time about, because you've talked so much about the right to health, and I see that that's an area where you do a lot of work. I'd like for us to talk about, how can digital technologies, artificial intelligence be our ally in advancing the right to health? Specifically focusing on some of the areas where we have had struggles, where we have struggled in Nigeria, in Kenya, across the African continent in fulfilling, health rights. They say that AI and artificial and technologies are disruptors. They disrupt, gaps, in service delivery, disrupt gaps in structures, in infrastructure gaps. Um, is there a possibility or a promise that can flow from uptake of digital technologies and artificial intelligence? So I'd like us to dwell on the positives and see whether there are things that we can talk about to encourage our policymakers to think about the futures for our respective countries. And over to you, Coyote.
All right, so, well, at this point, we need to bring it home. And just want to make a request that the next time we bring in Alan onto the show, let's ensure that he is back in Kenya.
I can definitely guarantee you I will not take an interview unless I'm in Kenya for purposes of my honor. But I just want to quickly say
Yeah.
there are indeed positives, and this is exactly what we're trying to do with this research. Despite the fact that we did find the risks, there are actually mitigating factors in our report that we talked about. Time will not allow us to do it, but definitely the goal is to figure out how do you make AI work for good? And if there are risks, what do we do to mitigate these risks? Because at the end of the day, we know AI is useful. It's just a question of what do we do to make it work for us and not it controlling us or people using it for things that will cause more harm. So The aim of the study was to see the risks, provide recommendations, and then work closely with grassroots groups and communities to see how to bring these recommendations forth. So I'm ready for part 2 in Nairobi.
Thank you.
You're a man of honor. Thank you so much for that. We do appreciate that. Alan and Alan Maleche. I hope I got the pronunciation right.
Perfect.
Great, great.
Yes.
Maleche joining us all the way from Canada, and of course, Professor Uche Chukwu Ongwaba also joining us all the way from Canada. But you know already, you're a part of this program, is a regular. But for those who have just tuned in for the first time, he is an assistant professor of the Lincoln Alexandra School of Law, Toronto Metropolitan University, and managing partner of Marsfield Legal Practitioners, a transnational law practice with offices in Lagos, Abuja, and Toronto. He currently leads a program of research focused on advancing a regional health governance approach in the Inter-American and African human rights systems, respectively. Gentlemen, thank you so much for your time this morning.
Thank you very much for having us.
All right.
Thank you, Bara.
All right,
Thank
and
you,
that's
and
how we
really
draw the
have.
curtain. Yeah, that's how we draw the
Okay.
curtain on Today in Global Health today. Stick and stay with us because right here at Lagos Talks, we care so much about you, not just your governance health, but your actual health. And let's see how that turns out. My name is Olu Akadi. Up next is the World News at Noon.